The African Population and Health Research Center (APHRC) is a non-profit, non-governmental international organization committed to conducting high-quality and policy-relevant research on population and health issues facing sub-Saharan Africa. The center, established in 1995, has three core programs, namely research, policy engagement, and capacity strengthening. Our research focuses on urbanization and well-being, population and reproductive health, health systems and challenges, and education. In developing countries, the urban population is growing at an extraordinary rate. In Nairobi, Kenya, for example, the informal settlement hosts over 60% of the urban population. Besides ravaging in abject poverty with limited access to basic services and utilities, including lack of education and facilities, the urban poor continue to register poor health outcomes and high disease burden. The center runs a longitudinal surveillance system known as the Nairobi Urban Health and Demographic Surveillance System (NUHDSS) in two urban slums, Korogosho and Viwandani in Nairobi, Kenya. The research in these slums explains the challenges and needs of the urban poor and seeks to demonstrate cost-effective intervention strategies that can be implemented to improve the well-being of people living in these slums. The NUHDSS collects demographic data from 60,000 individuals in 28,000 households 3 times a year.
The government currently is engaged on slums upgrading program with UN Habitat and others. So there is a change of attitude, a change of perspective in terms of slums. And in many of the slums, not just Kibera that many people are aware of in Kenya, you think about Matera, you think of Korogocho, and many other places, there are a number of initiatives being undertaken by the government to actually improve life and well-being within these conditions.
Through the support from Flora Family Foundation and other development partners, APHRC has, in a small way, been able to give back to the communities, like provide donations to community organizations involved in helping people who were displaced and adversely affected during the 2007 post-election violence, building toilets and other sanitary facilities in the community, providing sanitary towels to needy girls, provision of water and sanitation facilities in schools, training teachers, training of civil society organizations in the two communities, and sponsoring bright students to further their education.
We are planning to upscale or to scale up the program to 2 more schools every year in Korogocho and in our comparison slum, which is Viwandani, and we didn't get the intervention yet there, so we want to start helping that community as well.
Research by APHRC shows that the poor living in the urban areas are increasingly becoming affected by cardiovascular diseases, with 17% of the adult population in the slums having either high blood pressure or diabetes. An analysis of the public and private health centers further indicates that they are least prepared to deal with the situation, as these health centers lack basic screening equipment and majority of the medical staff are not trained on management and care of these conditions.
So we decided to set up outreach clinics to screen these people and provide free treatment. And so we did that we've been doing that since April 2008. Actually May, the project started in April, and we started treating patients in these free outreach clinics, which run in the 2 slums. We operate in 2 slums, Korogocho and Viwandani. They operate every Saturdays fortnightly. And we provide free screening and free treatment for these conditions.
With support from the World Diabetes Foundation, APHRC has collaborated with other stakeholders to train 117 healthcare providers in 15 healthcare centers in Nairobi on management and control of diabetes and high blood pressure. APHRC has also donated state-of-the-art screening and monitoring equipment to these health centers. These equipments include, among others, blood pressure machines, glucose meters, weighing scales, and stethoscopes.
The initiative the APHRC has taken is very much important, because as much as they give the medication to the slum people, they are trying to eradicate the problem by controlling the problem, giving the right medication and the right education. So it's very good, and whatever they are doing, they should keep up doing the work.
The journey to good health for all has begun in earnest. APHRC is among the pathfinders to a healthier world for millions of people like Harry and Margaret who, because of poverty, often give up because there is nowhere to turn to when faced with a seemingly degenerative medical condition.
Nimefundishwa mambo ya malezi, kukula zile chakula natakiwa nikule kama nikiwa na sukari, na ndio naendelea naye, na pia mazoezi pia.
Nimesaidika juu beleni sikuwa najiweza kununua ni madawa. Saa ingine naandikiwa madawa na kuja na shida na kununua juu sina pesa. Lakini wakati ule hao walikuja mpaka kwangu kwa nyumba wakanipima wakakuta niko naye. Sasa wakaniandikia niende huko kliniki hiyo ya Malemba. Vile nilianza hiyo kliniki ya Malemba waliendelea kunipatia madawa.
We've gotten to the point where we know the world is increasingly an urban world. Half of the world population are living in urban areas. And for Africa, we'll be reaching those milestones very soon. Maybe by 2020, 2025 or 2030, we will get to that point. And increasingly, what happens within this context will drive what will happen within the countries, because what happens to the urban poor, who will be majority of the urban population, who will then be the majority of the population as a whole, will increasingly determine how the country fares in terms of its national goals and national indicators.
African Population and Health Research Center, promoting the well-being of Africans through relevant policy research on population and health.